If you have a tearing issue, we first need to identify if you're overproducing tears or underdraining tears. And so I lump tearing patients into two big categories. Either you're an overproducer, meaning you're making too many tears, and that can happen from allergy, from dryness, from irritation of the eye in some capacity. And so we need to identify that problem and treat that problem, often with drops and ointments and medical therapy to improve the overproduction of your tears. The second category, the underdrainers, as I call them, we can typically surgically improve. So the tear drain starts in the inner corner of the eyelid. You have tiny little openings in the inner corner of your eyelid, one in the upper lid and one in the lower lid. They're called punctum. Those punctum drain tears. They work like a bathtub drain, and they drain tears through tiny little tubes called canaliculi to your tear sac. And your tear sac sits in the inside corner of your eyelid, right behind where your nose pads for your eyeglasses would sit. That tear sac then dives deep into the bone right here and enters the nose inside. And that's where your tears drain. So your tears drain naturally into the nose. That's part of the reason why your nose runs when you cry. And if you underdrain tears, there may be some anatomic variability or change in the position of your eyelid or blockage of your tear drainage network that we need to identify on exam. It can run the gamut from having a loose eyelid, so if your eyelid isn't in tight approximation to your eyeball, like having a loose windshield wiper, we may need to tighten that lower eyelid through a surgery called an ectropion repair. There's a possibility that the punctum could be too small, and we may need to enlarge that drain so that more tears can be captured. Or it could be that your tear duct is blocked, and we can identify that in the office through a small procedure where we irrigate saline solution through your tear drain and determine whether or not it's open. If the tear drain is blocked, you would be a candidate for stents to be placed in the tear duct or a tear drain reroute operation called a dacriocystorhinostomy or DCR.